Hi, I'm Heather Ayosa. I am a student at University of Texas Arlington's Master in Nursing and Education program, and I am going to take a few minutes to talk to you about the pathophysiology behind congestive heart failure, or CHF. CHF is a disorder of the heart where the heart cannot pump effectively, and it can affect either the left side of the heart, the right side of the heart, or the entire heart altogether. It can occur acutely through damage caused by myocardial infarction, or it can occur over a long period of time through poor diet, obesity, or chronic heart conditions like atrial fibrillation. It's typically diagnosed through symptoms depending on which side of the heart is affected. Left-sided heart failure affects the ability of the heart to pump oxygenated blood out of the lungs and into the systemic circulatory supply. So the blood becomes congested in the lungs, causing fatigue because the body's not getting an oxygenated blood supply, basically. So you're going to see pulmonary edema, which is fluid that backs up into the alveoli. You're going to see cyanosis because the body's not getting adequate oxygenation. On the physical exam, you're going to hear crackles or rales when you auscultate the lung fields. And this is what crackles sound like. Patients will be dyspneic. They will have orthopnea, which is shortness of breath when lying flat, and they're going to have paroxysmal nocturnal dyspnea, which is shortness of breath suddenly in the middle of the night, just out of the blue. And so here's a picture of a patient that has central cyanosis. That can be typical of left-sided heart failure. Notice the blue discoloration of the patient's hands. Patients who have right-sided heart failure typically have pulmonary heart disease, such as pulmonary hypertension. Therefore, these patients are going to show signs of fluid retention, like pitting peripheral edema, ascites, and liver enlargement. So they're going to not be able to get that fluid pumped back up. They're going to have JBD. I'll show a video of that in a sec. And patients who are bedridden are going to have sacral edema. So roll these folks over, look for a bulge at the base of the spine. So here's a video of a patient with a pulsating neck vein. And here is a photograph of pitting edema as well. Patients who have biventricular failure or failure of both the left and the right side of the heart develop pleural effusion because neither of the ventricles are working effectively to pump blood into or out of the lungs. There really is no gold standard for CHF diagnosis. Like I said before, it's really based on symptoms. However, a doctor will order a BNP, which stands for brain natriuretic peptide, and that is an enzyme which elevated can indicate CHF, but that's not always 100%. Patients can have CHF and have a normal BNP. Doctors can also order an echocardiogram, which is an ultrasound of the heart that can measure stroke volume and ejection fraction to show how well the heart is actually pumping. A chest x-ray can show whether the heart is enlarged, because a heart that has CHF, a congestive heart, eventually over time is just going to get big and floppy and just like a patient in CHF exacerbation should also have a troponin drawn, a cardiac enzyme marker, to ensure that that patient isn't having a myocardial infarction as well. Treatment for CHF is to improve and manage symptoms and to prevent disease progression. So first-line treatment is going to be an ACE inhibitor and an ARB to preserve systolic dysfunction. Typically don't use digoxin that much anymore. It's got a narrow therapeutic window and you've got to monitor. It can be toxic. We want to do lifestyle modification, low salt diet, fluid restrictions. Some patients will have an implantable device such as an AICD, left ventricular assist device, and some patients may also undergo heart transplant. I hope this helps you understand the pathophysiology behind CHF. Thanks, everybody.